Our team, welcome back to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon, and here with our celebrity cast to talk about buccal fat pad removal in the V-shaped face, or as some people, i.e., Austin's most beautiful man, Gilberto, describe it, the inverted triangle. And he'll explain why that's a better term than the V-shaped face. So we'll get to that in a little bit. I don't want to spill all the nuggets before we get started, but let's jump into what everybody's had going on over this last week or two and kind of see what's going on. Celebrity, you want to kick us off this time?
Oh man, this isn't going to be a good thing. I was in a fit of rage last weekend.
Ooh,
Bad
ooh.
sushi?
No, not bad sushi. Bad experience with a car rental.
Ooh.
Long story short, my wife and I, at your Trinity
I mean,
therapist.
that's because you hadn't plugged her in a
I
while.
hadn't.
And you hadn't traveled in a little while. So,
We
I
have
mean,
not traveled
no
in a
wonder
while,
you've been
but
angry.
Fully vaccinated now, and my mentor from Arizona, he and I have been in real close contact over the past 5 years, and he's really helped with me with my career and getting started with the business and everything. And he's retiring. So after 35 years of practicing cardiac anesthesia, he was retiring. So we went out there for the weekend, went to his retirement party and everything. But we booked a car through an app, which I guess shall remain nameless. But this app is kind of like the Airbnb of car rental. So people can put their cars up, and you just rent directly from that person. So
Were you picked that up at the airport, or
No,
you
so-
have to go to their house?
So you either pick it up at a set location, which is predetermined on the app when you schedule the car, or they will meet you at the airport with the car. So, and it was our first time using this. We have, we have probably 10 friends that have said we've used this all the time. It's a great app and all this good stuff. So I schedule it. We go through the whole process. We get to Phoenix after we wake up in the morning and our flight gets canceled by Southwest. Then they try to reschedule us for 12 hours later. Anyway, we end up making it there after flying to Chicago and then out to Phoenix. So 8 hours in the air to get to Phoenix. We get to Phoenix. I messaged the guy from the app and I said, "Hey, we're on our way to pick up the car." He said, "Oh, well, it's not that. It's not the address that's listed on the app. It's this address." And he gives me an address that's 45 minutes north of the airport.
Oh, wow.
$75 Uber ride later, we end up getting the car. So that was
But
red flag.
that's the price of a rental.
Oh, exactly,
Yeah.
exactly. So I am heated at this point. We get the
But
car.
what did they say? Because that's a huge
Oh, so that was the thing. This company that has the app, we could not get in contact with anyone. It's all just a bunch of pass the buck to another department, nightmare. So everything ends up going okay for the next 2 days. And then we drive into Scottsdale, which is about 20 miles or 25-minute drive from Phoenix. And we're out there, and the check engine light comes on our way to the mall. So we're at the mall, we're doing stuff. We come out of the mall. I go to turn the car on. The check engine light is on, and now a flat tire light is on. I walk outside. The tire is completely flat, sitting on a rim. We're inside a parking garage. Look at Mary. It's like, you got to be kidding me. At this point, I'm about to lose my mind. So we get a tow truck. They end up towing the car away. Then we cannot get in touch with anybody from the app. So we just didn't have a car for the next 2 days and had to Uber everywhere. It was an absolute nightmare.
So what do? You call the owner and say, "Hey, your car got towed"?
Exactly. So we contacted him, and he was not very nice. Then I think everything's completely done, and he was like, you know what? He, I guess, contacted the app and was gonna give us a refund for like the $100 it was that the car rental was. It was nothing. So. The next day we're at the airport, and
I can't wait to live to the day where $100 is nothing.
No,
Dude,
no,
make it rain.
I-
Lighting
I
my.
meant for-
Can anyone who lights their candles with $100 bills like Celebrity Anesthesia? Can you slide into our DM and just give us a hand raise? and be like,
business
me
has
too,
been good.
me too.
we
Damn.
rented the car for 4 days.
For all my
and I really did
patients,
not
now
think-
you know why you pay so much for anesthesia, because somebody's got to light their candles with $100 bills.
I did not think $100 for a 4-day car rental was that bad. So we end up getting that money back, and we get a call from an unknown blocked number when I'm at the airport the next day flying back to Austin. I answer it, and it was the guy whose car we rented. He said, "Hey, I talked to the app company, and they are going to give you a full refund." I talked to him about that, but only if you give me a 5-star review. And I was like,
that's blackmail.
"Whoa,
That's
you're trying to
blackmail.
shake us down over here. It's not okay." So it's just been a nightmare. So we ended up making it back. Car experience was terrible, but it was awesome to be able to go to the retirement party, and it was a good way to send him off.
That's awesome. Well, that was nice of you.
Yeah.
But it was fun. I mean, he's done a lot for me, and I mean, I'm sure you've had a handful of mentors in your life that have really changed the game for where your career trajectory. So, and that's how I feel about him. So,
Awesome.
it's good.
Tall Gamer, what's going on? I know you've been dating on Craigslist, and that's been off the hook. So catch us up. What's going on?
Man.
And I like the alternative method that you've taken versus what Gberto does. Gberto likes Bumble, Tinder, the mainstreams. You like to be off the beaten path a little
First
bit.
off,
Living on the edge over here.
Yeah,
off the beaten
but it's
path.
a different. But I like what you're doing because you don't want to be like Gberto and show up to a party and all 5 of you have dated the same girl that's there. So you're taking a different method, and I can respect that.
it's all about the new year, new me.
Okay.
Right?
All
Okay.
right. All right.
Yeah.
But besides that, no, I've been actually pretty busy with the next big project, right? So
Oh, what's your next big project?
it's unannounced. But hey man,
I love the. Hey, I've been super busy with this project. I can't talk about it.
that's the great, that's the great thing.
That's code for like I've
That
been walking around my house in my underwear watching TV till noon, and then I maybe shower once a week, and I haven't done anything.
That's
we
the
have
great thing
playing
about
video
video
games.
games.
We live in
Cheetos.
Austin, Texas, and you and I both have enough friends that are in tech to know what that really means. I'm working on something big. We just can't talk about it.
This is what that means for the people at home. That means I'm
For
twiddling
those
my
watching on
thumbs.
YouTube.
Yeah, no. Got a lot of great stuff going on. So one of the things that I've been working through is that actually my studio is expanding, and so that's always fun during the pandemic, right? So it's like growing a team inside a pandemic and trying to interview people, getting them equipment, and all these other challenges. It's been a big one, and so that all of that stuff is happening because of this new big contract, and so it's just like a lot of headache, but fun headaches.
Awesome.
All right. Austin's most beautiful man. What's going on with you?
Just trying to get a little bit more involved with this pickleball game. It's pretty fun.
Okay.
Yeah, played
Okay.
played a little bit over the weekend, and yeah, it's been good.
Any love life updates since your mom updated your profile? I
Nah.
mean, I feel like you now have another competition out
I
there,
know.
another shark in the water, if you will.
I had to fire my mom.
Oh, really?
Yeah.
What?
Why? What did she do?
It's not safe for work.
You,
This is a family show, John.
do you feel like she was being a little too sensitive on your profile, or not describing you in an appropriate light, or what was going on?
That's a topic for another day.
Okay.
Yeah. It's still it's a sensitive
But
sore subject.
was she answering the questions on the profile, or she just made the profile? Because that'd be interesting if she was doing the conversations
Oh,
and
yeah.
being like,
No.
"Hey, I'm setting up my mojito."
It's like a ghostwriter.
No, she just set up the profile, but it's the way she set it up. I'm like, we can't have
What
this.
what would be cool is if she came along to kind of like moderate the date, you know,
Yes.
and that way like
Yes.
kept stuff flowing,
Yeah.
kept stuff
Little
moving.
date coaching.
Would that be
Yeah.
cool? Would
I
that?
think it would be.
cool?
I mean, it would be. Us with the table next to you would rather enjoy this. I would order some popcorn. This would
Absolutely.
be a phenomenal show for us.
That's the new
maybe we
podcast
should
idea.
take the podcast on location to watch this.
I like
so
that. I like
okay,
that
Hence
cool.
the reason I'm still on the dating apps and haven't found anyone. Because with a crew like this and my mom writing my profiles, there's no way I'm ever gonna find anyone.
No, nope.
With all that excitement, let's jump into it.
Wait a minute, Johnny. What have you been up to? You didn't tell us about you.
What have I been up to? I'm trying to go visit my brother. My niece just had her 1 year birthday yesterday.
Nice.
So that was her birthday, and it was kind of cool. Sent her first pair of Jordans. And
Nice.
Very nice.
I tried to get some of the new release drops, and I was 30 seconds late, so they were sold out, of course. So boom, 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 gone. But they still had the infant sizes, so bought her a pair of infant size new drop Jordans. So
There you go.
that was super cool.
Nice.
And so that's kind of it. My mom's super excited. She's getting vaccinated today. is her second dose. So
So we got babies and Jordans, and then we got people lighting candles with $100 bills. Man,
yeah. Yeah,
Life's rough out here.
it's a tough group.
The little baby Jordans are actually a lot cheaper because it takes a lot less material. Yeah, it's true. It's true. You're welcome. Let's jump into the fun parts here. So we're talking about buccal fat pad removal, the V-shaped face, or as Gilberto likes to call it, the inverted triangle. And so maybe you guys can slide in, let us know which term you like better. We'll roll with G since he's the injectable expert here. But why don't you get us caught up first with, I like buccal fat pad because I think that's a hot one that we hear about. Not everyone truly understands what it is, but I thought it was best in context because it's really, I feel like the icing on the cake when people are trying to get this V shape or inverted triangle, as you like to call it. Do you want to maybe let people know what we're referring to when we're talking about the inverted triangle or V-shaped face and what that is, and we kind of maybe start at the top and work our way down? How we get there?
Yeah.
I love
So
it.
essentially, the inverted triangle or V-shaped face is a way we look at the face, like when we're looking at the patient head on, and we're kind of looking at the cheekbones as being like the widest part of the face, and then trying to create more of a V shape, like Dr. Franco likes to refer to, as we come down towards the chin. And so it kind of just creates this like nice, sleek, contoured kind of face that looks youthful and just very well defined. So.
Can you, for everybody listening at home, just so we can picture this a little bit better, can you name like maybe a celebrity or man or woman that kind of has that look that patients ask for?
One that I hear of quite often is like Angelina Jolie. She's a good example. She's got really nice high cheekbones and then kind of has this like sleek like contour to her face where it kind of comes to a point at the chin, like nice sharp jaw angles and stuff. So she's one that I would probably
Kylie
refer
Jenner.
to. Yeah.
I feel like people bring that picture in a lot. And a lot of it too, remember we're trying to enhance your natural beauty. So, don't want to get trapped into everybody else. And it's very hard with Instagram and those things. Also remember that a lot of those pictures are airbrushed, touched up and so forth. So, I always tell people you're being way, way, way too hard on yourself. It's just tweaking a little bit of those things. But it's really defining some of those angles. And I think this day of Zoom meetings, social media, selfies, I think all those things look a little crisper, give us a little bit more shape. Remember the old saying, the camera adds 10 pounds, and I think people get a little tough on themselves when they have some of these roundness. And it's funny because we do some of this even without thinking about it. If you've noticed the very kind of shaped beard that's shaved down, most people have the beard and then, clean up the neck because that also gives the illusion of a more defined jawline and gives the illusion of some of that V shape. Because if you think about it, with most of the stuff we do with in-office fillers, injectables, things, most of it is adding. There's a few things now that we can do to take away, but it's a lot of plastic surgery magic to give the illusion of a more narrow, sleek shaped. And sometimes those angles actually make the face look thinner and more defined. Even though you're adding product, you look thinner.
Yeah. Sometimes I wonder how many cameras are on me.
Why don't we, because I listed a few of these and you tell me if I missed some that you like to treat, but for when we're looking at the V shape, and I typically tell people it's a process. It's very rare that we're going to treat all of these things in one setting, and for most people a lot of times they already have a couple good features, and then we're maybe treating one that isn't as well defined as the other. Sometimes we can tweak a couple of them and try to figure out which is going to be the biggest bang for their buck. So if you start from the top down, cheekbones, as you already alluded to, kind of sets that top of that V or the top of the triangle, however you want to look at it. Buccal fat pad, remember, it's just a little tweak. It's the lower third of the cheek. It's not going to reduce the entire cheek. It's just the lower third here just gets it down just a touch. Just again to give a little bit of that angle. The jawline augmentation sets that bottom part of either that V or that triangle to give you a very defined angle so it comes to a point, and that goes to the Angelina Jolie and these very chisel type look stuff, which even if you have a little bit of a round face, you can give it a little bit more of that sharp angle, which gives it a little bit more definition, makes your neck look a little bit better. Another kind of secret little nugget is the masseter muscle. Sometimes if people have really strong masseter masseter muscles. You sometimes grind your teeth when you're stressed, which I don't know why people will be stressed over the last year and a half. Nothing going on. But injecting those can sometimes thin the bottom third of the face as well to get that down. And then sometimes treating the neck, either whether it's a Kybella, neck lipo, those things, just to kind of finish that off. But those are some of the biggest ones when I'm looking at a V or inverted triangle face that I'm evaluating.
So
other.
I got
okay.
a question. Well, I have a question though. So, or maybe something to kind of point out to the listeners more so than the viewers of the podcast, which you can see this podcast on YouTube. But when you were referring to the buccal fat pads and you touched your face, you were touching the cheek and not necessarily like the
yeah, and we're gonna get into each of these in just a minute, but I want to kind of give people a reference. Any ones that I missed?
Chin.
That's a good one. Yeah, coming all the way to the chin.
That's kind of a popular procedure right now where people are getting a little bit of filler product in their chin. There's Botox that can be put into the chin to smooth out the appearance of the chin. Mostly to help with just like your profile balancing, just to kind of look a little bit more balanced when someone's looking at you from your profile. So I think chin is a good one.
And this again goes to a provider that can really help guide you, because Botox around the mouth stuff I think is great, but you got to be a little cautious, and you can sometimes make the jaw and chin look a little bit longer, more refined, smoother by just a tiny little bit, but you can also change people's smiles, so you got to be a little careful. You can do a little filler to bring it out if you're just trying to camouflage a little bit. And any other areas you look at when you're trying to create this inverted triangle?
No, I mean, I kind of just look at the patient head on, and then I kind of look at them from like a 45-degree angle and profile, just to kind of get a good look at all their natural contours and features and stuff, and make my assessment from there.
Okay. Tall Gamer got a little ahead of us, but we're going to go through each of these. That way we can hit up. And I just figured we'd start from the top and work our way down so we don't skip around too much or confuse people, because I think it all goes in context. And to your point, we'll dive a lot deeper into each of these so everybody knows what's going on. But let's start with the cheekbones. How do you treat the cheekbones? How do you start setting this? Because you got to start somewhere.
Yeah. So I use dermal fillers in the cheekbones. Like I said, the first thing you have to do is assess the patient and see where their deficiencies are and what their enhancements are, like their natural enhancements, and kind of bring those out a little bit and then work on those deficiencies. And so with cheekbones, I'm always looking to see if they have flat cheekbones, if their cheekbones are kind of already rounded, if they need more lateral cheekbone augmentation, just to kind of give them that wide appearance from, like you said, from the top down.
It's funny that you brought this up, because when I see somebody, like if celebrity was coming in for the very first time for a consultation, I typically tell people like, hey, let's start from the very top, because that way we can, and not saying that we're going to address everything, but let's look, that way we're organized about it. And it goes to what we talk about in the surgery center, like being very organized so nothing gets missed. It's very structured. And so, hey, here's this, you need Botox, you don't need it, X, Y, and Z around the eyes, nose, and just kind of working down. So it's very methodical, and I feel like it's easy rather than for people, because it kind of gives them all the way down rather than jumping all over the place, which sometimes can be confusing. Sometimes it's hard for us, and then even for your assistants to be able to organize something for them and then be like, okay, we talked about all the things you need. Here's the 2 or 3 things that I think is going to make the biggest difference right off the bat for you.
Yeah, no, I agree. I think having a methodical approach, like you said, is ultimately going to be in the best interest of the patient.
What do you like to do for cheekbones? And it's interesting because you treat it with dermal fillers, as do I in the office, but even in the surgical world, and you see this, and you see a lot of different people do facelifts. How they treat that is interesting, because people will do fat grafting. Some people will lift what we call the SMAS, and we need to do an episode on facelift, so we'll do that soon. They'll lift that inside structure, and they actually reset it along the cheekbones, because they're trying to set the exact same thing with the internal structures and reset that, which pulls it up, lifts the jowls, and then sets the cheekbones as well. So kind of cool.
It's almost like when you create an internal bra with your mastopexy or augmentation patients, you're almost doing that in the high cheek area with that SMAS.
So like an internal mask, internal chin strap, maybe,
kind of, or like almost like a face corset.
Ooh.
A face corset.
Yeah.
You're
Yeah.
welcome, world of aesthetics.
Let's coin that.
Let's trademark that.
Yes.
What products do you like best when you're focusing on the cheekbones? And I know we've talked about it in the past, but it's
Yeah.
nice to kind of have it in one easy spot for people.
So I like
And there's new products all the time.
Yeah, there's new products. I like more robust fillers that are a little bit thicker and that create a little bit more lift and volume. So Voluma is a really great one for cheeks. I really like lift. But I was recently introduced to the new filler we talked about a couple episodes ago called RHA, and that is really, really impressive. That's really nice. I did some filler on one of our staff members as part of my training. We use RHA4, which is their like more robust, thicker filler, and it was really impressive what it did in terms of not only creating more of a rounded, like apple-like cheek, but also creating a little bit of lift for that patient. I liked it a lot. It might be my new go-to.
Wow, that's a bold statement. Wow. Okay,
Yeah.
cool. Well, we may have to circle back to that.
I have two questions as far as filler go. Number one, how do you accomplish a balanced look without making a patient in this cheek or high cheek area look overfilled? Because I feel like that's something that gets run into really quickly, right? Like, and it's really easy to cross that line, and then you see the patient that we've all seen before, who is has that Beverly Hills housewife look of the early '90s, just overfilled, real big up here.
I think a lot of it has to do with talking to the patient, what their expectations are, and trying to set those expectations as best as you can. And with overfilling, my approach anyways, and Johnny may disagree or take things a different different way, but I tend to ease into it, and I'll do like one syringe, divide that half a syringe per side, have the patient look at it, see what they think, see what how they feel about it. If they like it, we stop there. If they feel like they want a little bit more fullness, we'll do a second syringe. Some of that is swelling, so they have to take that into account too.
Sure.
And sometimes they'll want to let the product kind of set and let the swelling go down before we bring them back and do a second syringe. And that way you don't run the risk of overfilling, and just you don't want to just like be pushing product into someone's face, because that I think you're doing them a huge disservice that way.
I also think, though, you can correct me if you disagree, but that doesn't happen by accident. Some of these people that just have these massively overly done fake, it's not like they got one syringe all over their face and they look massively fake.
Yep.
In general, it tends to be, at least in my practice, more common where people are undertreated. People don't do enough, because it's different if you're 20, 30 and you're getting one syringe. That goes a long way of defining you, just giving you some nice definition. If you're 60 or 70 and you're trying to do one syringe, you're not going to see any difference. And so I think people who get overfilled and so forth didn't happen by accident, and I promise you didn't happen with one syringe.
Yeah, no, I agree. And to Johnny's point, I mean, it takes a lot of product to get to that point, and so there has to have been like some conversation about this is what I want.
But I think that's good to know for lay people that are out there that don't understand that like one filler or one syringe of filler is not going to create this monster look where you've just got this massively overfilled face. And I feel like that's a little bit of a misnomer in the market out there. People don't understand. They, oh my gosh, I don't want filler because I don't want to look all puffy. And it's like one syringe. If you ever seen one syringe of filler, the amount of volume in there is like less than a teaspoon.
It's a fifth of a teaspoon is what I tell patients. I'm like, think about a teaspoon. Teaspoon is 5 mLs. Each syringe is 1 ml, so it's 1/5 of a teaspoon. So it's not much. In the right patient, it can go a long way, but oftentimes you need a lot more than that.
Especially if you're treating multiple areas, because it can go a long way. So I think the take home for that is one, and there's areas of the cheeks that you can treat an area to look good, and a lot of times I'll come all the way back along the cheekbone. I think kind of fool's gold is sometimes coming right to that very anterior portion of the cheek, right below the eyes, because it sometimes can give you a little look when you're very static. When you smile, then they can look overly full stuff. So there's definitely some little nuggets there, but I would say if you've never had it, 1 or 2 syringes is not going to get you to that look. Those are people 6, 8 syringes. I think people get this idea that they didn't want. It tends to get people into trouble when they try to get this idea that I'm going to be, a little bit mature in age and I'm going to have 0 wrinkles at all. My skin's going to be perfectly tight. Like, that's not natural, and you start to get an unnatural look if you're trying to do that.
I agree.
G?
I agree. And again, in my opinion, I think it just goes back to having that assessment, having that conversation, setting those expectations.
Let's keep working down the
Yeah.
face here. Let's hit up a little buccal fat pad, and I put this one in the title because I think it's something we haven't talked as much about. And this is a cool one because you can do this. This is more of a surgical procedure, so it's typically not something you're going to get done when you get the fillers and so forth. There's a couple different ways we can do it, and we can hit up on the anesthesia in just a minute. But I do it a lot of times in conjunction with other procedures where people are already asleep because it's a nice little easy add-on to tweak the face, especially if they're going to be a little swollen because they're already having time off to recover from something else. The procedure itself gets rid of these tiny little, it's actually a very discreet fat pad, and that fat pad size is actually very consistent from person to person regardless of your weight, which is super cool.
It's wild.
It's almost like the fat pads underneath the eyes. And so we can actually get through it through a little incision intraorally. So inside your mouth, we make a little incision, can just kind of spread, find that little nugget. We take it out on each side. And it's just the area below the cheekbones, almost just to the side of where your oral commissure is, the side just lateral to your mouth. And it just thins that cheeks just a little bit. If you have big round cheeks, remember, it's not going to get rid of the whole cheeks. It's just a little spot to thin that out, just a touch, which is super cool. All sutures on the inside, so there's no scars on the face to get rid of that. I do tell people for the first couple of days, you do look, if you ever had your wisdom teeth taken out, that's what you look like because you're a little swollen, puffy, and then it slowly goes down and gets you into a good spot. But it's a nice way to kind of attack that middle lower third of the cheek area, just to add to some of that slimming. But this is a surgical procedure because we do numb up the inside of the cheeks. Depending on people's tolerance, sometimes you can do it under local with some Pronox. A lot of times we'll do it with what you would call managed anesthesia care, where don't have to have a tube or something down, but can be a little bit of a happy place. Can do it, and you jump in. Can do it with the tube if you're doing another procedure.
So a couple of different options. We typically, when we're working together, do it in conjunction with another case that we have going. So like, let's say that we're doing a mastopexy or an augmentation or something, and then the patient also wants to add on that buccal fat pad removal. If those patients are already intubated and we're doing a general anesthetic, it doesn't change anything. It just extends the case for an extra 30 minutes. You make you add local anesthetic on the inside of the mouth, so that, or the inside of those cheeks for discomfort post-operatively, and it's very easily removed with that under that general anesthetic. Other option is you can do what you alluded to earlier, which is monitored anesthesia care, which is just sedation. We're give a little bit of sedation to reduce anxiety and a little bit of pain, and then we go in, and this is without placing a breathing tube or an airway in the patient's mouth. We're able to go in and make the patient sedated and comfortable enough so that he can deposit that local anesthetic on the inside of the cheek, and then go in and remove that buccal fat pad. Once that local anesthetic's deposited, it really is a painless procedure from the standpoint of the actual operation, because that cheek and the inside is completely numbed up. You also alluded to, some people do this in office, and they'll give patients a Valium or something to relax, and then they'll do the exact same procedure that we would do in surgery, but they're doing it, with either some Pronox or something oral, and then doing that local anesthetic inside the mouth.
Very similar to dental procedures, and you do
Very
that
similar.
where sometimes you just got to give people a little something to kind of help their anxiety and
Yep.
relax them a little bit, and so.
And as soon as you take that edge off, the main anesthetic at that point is the local that soaks in and bathes those nerve roots in the inside of the cheek and allows you to go in and remove that without the patient feeling anything.
Kind of a cool procedure, and kind of
very
cool how.
And what's crazy is, like, even from my perspective, I am not the aesthetic expert in the room at that point. I'm managing the airway, and when we do some of these cases, like let's say we'll add it onto a breast dog, the patient's intubated, and we finish the breast dog, we then go to do the buccal fat pad. I can see a huge difference immediately when we're done, because that swelling hasn't really set up at that point immediately yet, and it's crazy. I mean, you're talking about a very small nugget. What do you think about a small walnut size?
Yeah.
For the amount of the fat pad that's taken out, and it all comes out in one piece. It's pretty cool procedure. If you haven't seen it, on Dr. Franco's Instagram. He's posted it a couple times, and you may have a couple other videos online. But it's a cool little procedure.
And it's just interesting, something that again goes to kind of that overall contouring. And remember, it's not for everybody. Some people are already very slender. Again, it's going to make a subtle difference. So if you got big round cheeks, it's going to help just a touch. But it's all the other things too. Setting those cheekbones, doing that. So I think just kind of a cool little procedure that you've seen done a bunch of different ways. But in the end, it's the little nugget coming out and closing that. So kind of cool.
Yeah. So does that fat pad ever regenerate, or is like once it's gone, it's gone?
No, once it's gone, it's gone. But remember, just because that specific fat pad is gone doesn't mean you can't still put weight on your other cheek stuff. Because someone like me, when I gain weight, my face changes a lot. My face gains and loses weight. So just because that fat pad doesn't come back doesn't mean that you can't still put weight on your face.
Got it.
Cool. Any more Buccal fat pads, or we'll keep moving down the line?
No, let's keep moving.
Let's keep going. Jawline augmentation. That's honestly one of my personal favorites, and that's one that men and women both love. And I think men love it because it gives them a little bit of that stronger jawline without having to do a chin implant and so forth. I still love chin implants for the right person. But this comes all the way to the angle, all the way back, which actually sets that neck and that chin just right. So I love it, love it, love it. I think women like it. They just are always a little nervous that they're going to get a Jay Leno type chin. And honestly, again, just like our other overly done, that doesn't happen unless you go cray and it takes a lot of product to do that. Especially with jawline, it tends to be the opposite. I tell people, if you're not doing at least 2 syringes, maybe 3, depending on where you're at, you're not going to see enough of a difference if you're trying to do both sides, the entire jaw from, the angle of the mandible all the way around the front.
And full transparency, I actually did not know that this was an option before we started doing this podcast. And I remember we were first talking about the jaw augmentation and stuff, and our boy Gossip Greg, he's been very open about himself receiving the jaw augmentation, and like you can tell huge night and day difference. And he was even talking about it on the episode that he did with us, and it's crazy. I mean, just how much better structure-wise his face looked immediately afterwards. I was like, "Whoa, this is the real deal. That's a cool little bang for your buck procedure."
Yeah. No, it's nice. G, the procedure you don't like?
I like it a lot.
Have you had it?
I have not had it.
Oh, you're just that good.
You're
just that good looking.
This is my natural jawline.
Okay, cool.
That and the camouflage of my beard.
We did talk about that.
No, I like it a lot. I do it quite a bit in my practice. I use some products that Johnny's familiar with, and some others that he hasn't quite used yet. And likewise, he uses one in particular that he likes a lot that I haven't used much in my practice for the jaw. But I really like Voluma for jawline. I like Restylane Lift. I mentioned earlier this RHA new filler. I think RHA 4, although I haven't used it in the jawline, I think would be a great option for that. I know you like Radiesse in the jawline. So what do you like about that versus some of the HA fillers?
I like the bang for the buck that people get for it, because it typically comes in 1.5 cc's per syringe. So with 2 syringes, they're getting 3 cc's. And so that tends to get them just a little bit more of an augmentation. And like I mentioned earlier with the jaw, I just feel like most people are undertreated to get the shape that they want. And so just trying to be either upfront with people like, hey, you gotta, do enough syringes that you see the look, because they'll bring in those pictures of what they want. I'm like, hey, to get there, this is what we need. I mean, you tell me, when you treat somebody, how many syringes would you need for a typical jaw? I mean, is it very often that you can do the entire jaw chin with 1 syringe?
No, that's stretching it really, really thin. And again, I think you're just doing your patient a disservice, because they're not going to see much of a change. I usually tell patients we have to start off with at least 1 syringe per side, just to kind of get some effect from it.
Typically, when I do 1 syringe, it's because they've already had 2 and they're coming back for just a little tweak or touch up or something like that, which is super, super common. To your point about starting people slow, getting them in a good spot, we can always add on to that.
Yeah. So I got a question now. So, we've talked about cheekbones, buccal fat pad. Now we're on jawline. I know we have a few more things to cover, but with these 3 that we've talked about so far, is this a situation to where like, I mean, is this something that I can come into the office for and say get all 3 of these procedures done? Like, buccal fat pad removal, some product.
Well, remember the buccal fat pad typically not, because
well, yeah.
that's a procedure,
procedure.
that typically needs to be scheduled. Even if you're doing it in office, most people will block out time. Need to numb you. Most people will at least take a Valium or an Orco or something, and so got to plan to have a ride home. Those type of things. It's a little bit more involved. Any of the filler stuff, it's some numbing cream you can do in the office.
Lunch break.
Yeah, the cheekbones, the jawline. We're going to get to masseter and neck stuff here in a minute. So the surgical procedures, typically that's a little bit more planned out. I'm not saying that some people can't do it the same day, but most busy offices don't just have an hour kind of hanging around to do this. Plus, we want patients to know what they're getting into. And so, typically not the buccal fat pad.
I find it interesting that like as we go down the face, it's like you add in product near the cheekbones, you're taking stuff out of the buccal fat pad, and then you're going into the jawline and you're going back to adding.
But remember, we're only adding to give the illusion of a more defined stuff.
Right.
We're not adding to make the jawline and stuff wider per se. It's the right angles that give the illusion of a narrow, sleeker face. So this is a plastic surgery illusion, because a lot of people aren't saying that they want their lower face to be a lot wider, especially in women. That's not true.
Right.
Yeah, we want to try to make it slimmer.
So I don't want to confuse people with that statement. I think Tall Gamer's trying to play some Jedi mind tricks on our listeners out there. So go ahead, continue. Yeah.
So I was going to ask you. So when you're injecting your jawline filler, are you injecting right on bone, or are you doing like intradermal? Like what plane are you in?
If I'm doing radius, I'll definitely be on bone.
Mm-hmm.
A little bit thicker, a little bit stronger. That one I definitely try to be on bone, on the periosteum. So from a safety standpoint, I've started using more cannulas after we've talked, and with the cannulas and some of the HA stuff, I will be sometimes in a more superficial plane. But again, making sure that we're avoiding the intravascular injections, doing some safety things. I think this is where you can do some nice tweaking stuff if you know what you're doing, you're using the right safety protocols.
Yeah. Pretty much the same for me. I like to inject on bone for most products, even though I'm using more HAs than like a radius. So just from a safety standard. Yeah.
But the new product, the RHA, that was actually designed to be a little bit more
superficial.
Yeah. But you do cannulas when you do that one?
I do like cannulas for jawline. I just feel like I'm in a safer spot using cannulas, less likely to run the risk of any kind of intravascular injection occlusion.
Can we, just because I want to run short of time, you mind if we move on to, because I feel like masseter muscles is one we maybe haven't talked about quite as much.
Yeah.
And this goes in line with a little bit like complementing the buccal fat pad removal, but moving further back or posterior towards your ears. And most of us can bite down and feel, again, almost like you're saying, a little walnut feel that's here. And some people, if you grind your teeth a lot, have a very thick muscle. And again, it just slightly adds to the width of the lower face. The Botox isn't going to keep you from being able to open your mouth or talk. You're just trying to weaken that muscle, so that muscle, what we call atrophies, from those of us that don't work out like celebrity, our muscles atrophy just a little bit, and again, giving a little bit slimmer face to that.
I love it. I love masseter injections. Botox, it's so impressive what 20 units of Botox in the masseter per side will do for someone's like profile. It's really it slims the face really nicely.
But I think important for people to understand, unlike a filler, you're not going to see any difference that day, because we're dependent on that muscle to shrink down. So you're going to see that over time, not that day.
No, not that day. It does take a little while for that Botox to kick in and take effect. I usually tell patients, 4 to 7 days to starting to notice a little bit of a change, but by week 2, that you're pretty much seeing what the effect of the Botox will have on those muscles. That's
interesting, because I usually tell people a little longer, because I feel like that atrophy sometimes can take a little longer too. Yeah. But you tell me, I typically tell people, because it's definitely it's not nothing in terms of units, because typically, like you're saying, you're going to be somewhere between 40 and 50 units total to treat the masseters, depending on how strong those muscles are and so forth. But I feel like people get a little bit longer lasting out of it because unlike, your forehead and other stuff where you don't want to see any movement, as long as you're weakening those, the atrophy, I feel like lasts for a little while and then takes a while for people to build that muscle back up.
Yeah.
Jimmy, when you treat the masters, do you do it as often as you do the forehead and glabella, or would you say maybe even every other?
No, it does last a little longer. As I'm thinking of different patients that I've treated, there's a little more gap in between their visits. So yeah, I would agree with that.
I think it's just really cool, and it's interesting like how it works and how everybody has a little bit different approach stuff. I think you're really good about seeing your patients back at 2 or 3 weeks, so it's nice that maybe they are seeing a result a little faster than even I thought. So
Yeah.
that's really nice.
And it varies from patient to patient. Like you said, everyone's musculature is a little different, and so someone who's already kind of slim as it is, they may not have really like dense masseter muscles that require a lot of product, and they'll see an effect a little bit faster.
And this is interesting because, to your point, everybody's face is a little bit different. Like someone like celebrity who already has a very thin face, you would see a difference, nicely. Someone that's got a little rounder face like me, you may be like, hey, this isn't the spot that I would start, because even if we get that masseter muscle down, you may not see as much of a difference as you would like. We're better off going after your jawline or your neck in terms of that.
Yeah.
Just so we don't run out of time, let's hit up the neck in terms of the V-line stuff, and so I think that's an area where you kind of bring that all together, because if you have kind of a big full neck, sometimes you can do a lot of great work up here, but it still doesn't end, and that's where the jawline helps kind of separate that. I think, we've talked about Kybella in the past to help bring that neck in. If you got a little bit of fullness, if you got a lot of loose skin, you've lost a lot of weight, time has just taken its toll, then sometimes a neck lift is needed. But do you guys ever talk about neck in your practice in terms of that V inverted triangle, as you like to call it?
Yeah, we do. We do. Obviously, we don't do neck lifts, but some of the tools that we have at our disposal are like you said, Kybella. We have a device called Ultherapy, which helps tighten up the skin a little bit.
Which is a radio frequency energy as well, similar to body-tied J-plasma Renuvion, but over the skin, so you don't need the incisions, you don't need the circle treatment. With Ultherapy, do you do any anesthesia with that, or?
Yeah, usually there's like some topical anesthesia.
Okay.
It is a little uncomfortable, so.
But you don't need celebrity.
We don't need celebrity. Yeah.
A little uncomfortable.
Disapprove.
Do you put numbing cream on those patients?
For like procedures that
we need to rewind the podcast 30 seconds where you just said we put numbing cream?
No. I'm talking about for the uncomfortable part.
Yeah. It's a little more uncomfortable than injections into the scalp, Donald.
But just some people handle pain much better than others.
Yeah.
Okay.
I think that's
what it boils down to.
That's the take-home point here.
But that's cool. Ulthera, I think, some people can even do like the body tied or Renuvion J plasma. Again, that's one that, is a discussion with a patient. Some people can do it in the office with maybe either a little Pronox, a little Valium or something. Some people need somebody like Celebrity just to take a little bit of the edge off, and something to discuss with your provider.
Yeah.
I know some surgeons, derm stuff, have an anesthesia provider come to their office and certain days and help with some stuff like that. So there's options out there, but just got to discuss it with your individual provider.
Absolutely.
Yeah, I promise, Donald. You discuss it with me, we can put some numbing cream for your little shot.
We'll see.
What else would you say to wrap up kind of that face look stuff? Because I think that's something that has just become so popular, is kind of creating that shape, but being real with people about what they can do, because you don't want to change somebody's whole look. You're just augmenting the look they already have so they can be the best version of themselves.
Yeah, I think a couple things that we kind of brushed on earlier, like chin augmentation, either with fillers or with like an implant.
Yeah.
Maybe injecting Botox into the platysmal bands can help.
Ooh, that's another good one. That's a really good one.
I think those are some things that would help.
And just so people know what you're talking about sometimes people see just a very discrete band that comes from their cheek down towards their neck. Yeah. And that's a little band where their overall neck looks pretty good. They just have a few bands, and you can soften those just a little bit to let them come up.
Correct. So you're injecting Botox into the muscle, into the platysmal muscle of the neck. It's like this long sheet of muscle that comes from basically like your jawline down to the neck. And you can kind of see different bands form depending on, how you turn your neck and whether you like flex in certain ways or whatever. So you put a little bit of Botox into that, you can relax it and make the neck look a little smoother.
Anatomy by Gilberto.
There it is.
Any celebrity, anything you want to add in terms of the shaping?
Oh, only thing I don't know if you mentioned it that we didn't necessarily touch on a huge amount was sometimes some of these things can be taken care of intraoperatively if we are harvesting fat at some point during the procedure, because all of the HA fillers and all of the dermal fillers that you guys were talking about can also be done with fat. Am I right there?
Yeah, really for the most part, all of those, obviously the toxins and stuff, are a little bit different than fat,
Sure.
but for the fillers, for sure. And you've probably seen most facelifts nowadays include a lot of this fat transfer, because the old days of just making people so tight, nobody gets in and says, hey, I was in my convertible and I looked so good. And, I thought I'd come in and see you. So
I want that 80-mile-an-hour
yeah,
wind blown.
so now and that's why we talked about some of the internal structures, creating the cheekbones, pulling that up so that makes the lower third look tighter, because you've pulled that up, reset that, and so no question the fat adds some of that volume back, because we used to think that, and this is where we're attacking a few things. We used to think that age just meant that skin fell, but it's not that just the skin fell, or got loose, which is true, but you also lose volume over time. And you lose volume in terms of fatty structures. You also lose some bone structure. And this is why some of these products down on bone to restore some of that bony volume that you lose over time as well, especially if people have had some problems with their teeth, some denture issue stuff,
Sure.
Can lose volume, because teeth actually help keep that bony volume in both your alveolus and your mandible. So kind of interesting how that stuff all plays into one. So brush your teeth, keep those teeth. Well, what else? Tall gamer?
I'm good. I got all my questions answered.
Gee?
With fat transfer in the face, would you say that there's, for lack of a better word, more bang for your buck because you're using fat over HA fillers?
I think if you're having surgery, I think they're good options. But remember, I think fat's a little different. There's some really fine stuff that you can do with some of the fillers that you can't do with the fat. I think, remember, with fat, you do lose about half of that. So I think you gotta it's a little bit of a moving needle to try and get that just right. I think that with the fillers, one of the things that I love is that, and you mentioned it earlier, is you can do some product, let people look in the mirror, add more, just subtract more. You can do little bits at a time. With fat, it's just from a practicality standpoint, it's a little hard to do, like, hey, let's do 2 or 3, syringes of fat and then bring you back and do some more, which, is something that's harder. I think in a facelift, in a big fair swoop like this, I think it's super, super worthwhile for sure. I think for some of the small stuff or people starting out, I love fillers. It's like dipping your toe in the water without jumping in all the way.
Completely agree.
And one thing we didn't mention and why the HA fillers are so popular is there's actually some products out there that dissolve the filler almost instantly, and so, if you just hated it, if you had a problem, whatever, there's ways to treat that.
Yeah. Hyaluronidase is what you're referring to. It's an enzyme that breaks down the hyaluronic acid. It's phenomenal because it helps break down product in someone who doesn't like the outcome. But more importantly, if you do run into any kind of problems with like an intravascular injection or something,
or an infection,
you can break it down.
That's pretty cool.
Yeah.
And just so people know, those are all 3 of those are rare. It's pretty rare that somebody just doesn't like their look. I would say, if anything, the most common complaint or dissatisfaction I get typically tends to be when people think they're going to get a lot more change for a syringe. And most of the time we've had this discussion like, hey, you didn't lose this volume you lost this volume over the last 60, 70 years. One syringe isn't going to make up for 70 years, and so I think that's probably the most common thing, where people just didn't get enough product. Or sometimes, I try and get people to focus a little bit, because sometimes you're like, hey, I just want to spend this amount of money, which is 1 or 2 syringes, but we want to treat the temples, the cheeks. Temples is one we didn't touch on, and that's another good one, because I feel like that falls a little into the V. If you're super hollow, you don't want to accentuate those cheeks and then come down and have very hollow temples, not to get off tangent here, but sometimes makes that whole face flow a little bit, especially if you're very, very, very thin.
Yeah.
But I think when you're trying to treat temples, cheeks, jaw, chin, nose, and you only doing one syringe, I tell people, look, we're going to spread this so thin, you're not going to see any difference anywhere. And so it's just trying to be focused, like, hey, if we want to start with this, that's fine, but let's pick an area that's going to make a difference for you so you feel good about it, like you got something for it.
Yeah,
Absolutely.
Yeah, I agree.
And you tell me if I'm wrong, but because people always like, well, what's the best product or what's the best spot for this? Just depends.
It just depends. I mean, some products are better for certain areas. Some products are better for certain patients.
And some patients, one person starting with cheekbones may be the best option for them. Some people starting with jawline may be the best option for them. Some people need surgery. And you talked about it earlier. Some people just need a facelift. You're going to need so much product that to get you a good result, you're going to look overfilled in volume. So, there's people that we refer back and forth, in terms of stuff depending on what they need. And this is where a good provider to push you in the right direction is going to help you with that. They'll just have that frank talk with you.
1,000%.
The Franco talk.
I guess.
Hey-o.
Any little behind the bovine nugget you want to share with us?
It's something that you've alluded to in the past, and I'm gonna reiterate it. It's interesting how adding volume can actually make you look slimmer. It's really, really impressive how that works.
I think that's one of the plastic surgery magic that's just so cool is how you can add and subtract that. Because the other place that we do that is nose, where we add a little volume and it actually gives the illusion of a sleeker, smaller nose. So jawline and nose are the two where I think that is just absolutely true. So super cool.
Yeah.
We got a quote for the day? Anybody?
I got a quote for
Boom,
us.
let's do it.
This is from Roy T. Bennett, and it says, "Let the improvement of yourself keep you so busy that you have no time to criticize others."
Ooh.
I think a lot of people could take that one to heart. A lot of people could take that to heart.
I like that
It's kind of like the old saying, when you're pointing one finger out, you got four pointing back at you. So,
Exactly right.
no, it's.
You have four fingers pointing back at you?
I do because I go like this.
Oh, okay.
I'm not pointing up in the air, like I'm not
It's
triggering you.
It's just weird.
That's the gamer way. It's the gamer way.
Might want to see a doctor about those hands.
Any last take-home messages? Awesome. Well, I appreciate all you guys being here. I appreciate you guys getting up at the crack of dawn for Celebrity's busy schedule.
Thank you.
We'll do anything for celebrity.
Well, don't forget, you guys can download us anywhere you get your favorite podcast. So iTunes, iHeart, Spotify, Pandora. We're also on YouTube. Don't forget to follow everybody's handle. Donald, what's your handle?
At Tall Gamer.
Celebrity?
At Celebrity Anesthesia.
G?
And my wife at Your Trendy Therapist.
Boom.
At Austin Aesthetic PA.
And I'm at Austin Plastic Surgeon. So thanks for joining us at Plastic Surgery Untold, your favorite podcast voted by us. We'll see you guys soon. All right. Bye.
See ya.